National healthcare systems are going bankrupt. The math is failing because governments treat medical budgets as a single, bottomless pool of money. They mix the costs of sheer survival, like emergency heart transplants, with elective lifestyle procedures, like cosmetic hair transplants. It all drains from the exact same reservoir. Meanwhile, the industries that manufacture disease-causing products and the environmental toxins that fill hospital beds are left entirely off the financial hook. They keep their profits while the public pays for the fallout. To fix this, we have to tear up the utopian idea that everything can be free. We need a rigorous, logical financial architecture based on strict separation. Think of it as a ledger, 3 strictly isolated financial buckets that can never cross-contaminate. Balancing these 3 specific columns offers a mathematical framework to map every medical cost to a specific, identifiable source of revenue. The first column of this ledger is the baseline equation. This is funded by a strict, mandatory percentage taken directly from a citizen's standard tax deductions. This mandatory tax covers only the uncontrollable. It protects citizens from infectious diseases, aggressive cancers, and sudden severe trauma. It is a harsh boundary. This bucket provides 0 frills, serving strictly as a life-and-death social safety net. By capping this mandatory state fund exclusively at survival, the government prevents elective lifestyle choices from exhausting the public pool. That brings us to the second column, the voluntary upgrade. This is a separate fund designed entirely for elective enhancements and quality-of-life procedures. If you want complex dental work, like cosmetic surgery, or high-end physical therapy, the state does not pay a single cent. To activate this higher tier of comfort care, citizens must voluntarily route additional personal funds into this specific bucket. But human nature is predictable. People will try to game the system by paying nothing for years and only upgrading the day before they schedule an expensive elective procedure. This timeline shows how the system prevents that loophole. To unlock an upgrade tier, a citizen must back pay the premium for the last 5 years, or since they started working. This retroactive payment rule mathematically eliminates system gaming. It ensures the public state fund is never burdened by private vanity. The third and most aggressive column of the ledger is the retribution equation, or the health excise tax. This exists specifically to pay for modern diseases. It targets the industries producing tobacco, alcohol, opiates, industrial plastics, diesel emissions, and toxic chemicals. For decades, hazardous products have been heavily marketed and normalized as standard consumer goods. Today, environmental hazards, especially the toxic emissions choking urban centers, create massive, expensive public health crises. Under this ledger, 100% of these punitive taxes bypass the central government entirely. They do not enter a general slush fund. Instead, the physical purchase of a hazardous product mathematically pre-funds the medical cure for the disease it will eventually cause. This isolates the true cost of disease. It turns the corporate manufacturers of sickness into the primary, mandatory funders of public health care. We now have a balanced architecture, a baseline for survival, upgrades for comfort, and a sin tax for environmental and behavioral damage. This architecture functions by aligning individual financial choices with the real-world costs of public health. Separating survival from luxury forces citizens to make conscious financial choices about their care. Simultaneously, the point-of-sale sin taxes create a self-healing financial loop. True universal healthcare relies on math, not utopian promises. It is a system designed to protect the vulnerable, charge for luxury, and ensure the manufacturers of disease finally foot the bill.